So, hello everybody, this is the DMA's FMGE hacks, and the subject we are going to talk about is your ophthalmology. So, speaking about the ophthalmology, we proceed here. So, speaking about the ophthalmology, the high yield area which has been asked previously where your uveitis and glaucoma, and the second most area is your cornea, and the rest of the miscellaneous area has been mentioned here. So everybody will have a different version of your understanding of ophthalmology, but I prefer, like, we follow the same way. We divide the ophthalmology into four different categories and we read it accordingly to master it. Okay, so the first area is your anatomy and physiology of eye, and pathology of eye, and diagnosis and investigation, and medical management and surgical management of your eye. This is how we divide the ophthalmology into four regions. So technically speaking, so in the anatomy and the physiology of eye, so speaking of anatomy and physiology of eye, it is quite a really important portion that you need to remember. So speaking of anatomy of eye, external and internal structures of the eye, including the cornea, sclera, iris, lens, retina, and optic nerve. And the physiology of vision, like optics of eye, visual pathway, visual acuity, color vision, and visual field testing. Every single perspective of the anatomy and the physiology of your eye are pretty important, especially when you are talking about the anatomy of eye. The dimensions, wherever you see the named dimensions, and then you may see the refractive index of each structures of internal eye are pretty important, that you should not miss it. And then you should also know about the power of the eye, and then you will also know about the common and unpeculiar names, you have the peculiar names of your eye. For example, iris is so called as goddess of rainbow, so this peculiar names. And then anatomy of your lens and anatomy of your fovea centralis are pretty important, that you should not mess it up. And then physiology of vision, all the visual pathway where the conversion of levenses retinal to all transretinal is happening. And the role of your visual cortex in the occipital lobe. And then you have this what type of vision is impaired, where the lesion is in the optic nerve, or where the lesion is in the optic chiasma, or where the lesion is in the thalamus, or where the lesion is in the a visual cortex, what type of refractory what type of lesions, and what type of visions you may see in this entire pathway are pretty important. So every single aspect you have to remember, people, and you have to memorize about the anatomy and the physiology of eye, which is a quite important topic, which covers you 10 to 15% of your ophthalmology question. If you are lucky enough, it may occupy you the 20 to 25% of the questions of your ophthalmology comes from the anatomy and physiology of your eye. And then speaking about the pathology of your eye, you have the refractive errors, myopia, hypermetropia, astigmatism, and the presbyopia, all the things you have to remember. And then you have the ocular infections, where you see conjunctivitis, keratitis, endophthalmitis, and the blepharitis, all the ocular infections, and the glaucoma, open angle and angle closure glaucoma. And then cataract, types of cataract, causes, diagnosis, and management are pretty important. So speaking about the cataract and the causes, diagnosis, and management, your cataract, you see the important high yield area of your ophthalmology is cataract and glaucoma. You definitely get a one question from the either a cataract or a glaucoma, and either could be a types of cataract or types of glaucoma, or maybe the management strategy, or maybe the surgical intervention. Anything that is related to the cataract and glaucoma, you have to master it, people. And then you have the retinal disorders like diabetic retinopathy, macular degeneration, and retinal detachment. These are the areas where you have to focus in the case of your pathology. But speaking about it, anatomy, physiology of eye, and you have the cataract, you have a glaucoma, then you cover 50% of your ophthalmology. If you made these topics in a if you read these topics in a very nice way, then you can say like you covered almost like 50% of your ophthalmology questions from FMGE. So apart from that, you have the rest all in the diagnosis and investigation. Could be a like a visual acuity test, like a Snellen chart, near vision testing, and pinhole testing. And you have this ophthalmoscopy, direct and indirect one, and fundoscopy, and tonometry, applanation tonometry, and non-cataract tonometry, and imaging studies like OCT, optical coherence tomography, fluorescent and angiography. So all the named, investigations are pretty important. You may have in, like in your QRS book, you may have this entire set of your named procedures and named, named cataract, and then you have this named investigation tools. All of things has been mentioned in the, in a QRS series of your ophthalmology. So I better ask you to read, I better recommend you to read that. And speaking about the, apart from that, speaking about the medical and surgical management. So medical and surgical management, you have to remember about the anti-glaucomic drugs. What are the drugs? How you will give? What is why the prostaglandin analog is useful for the glaucoma, and why there is a, like a cholinergic drugs are helpful in the glaucoma. What type of cholinergic drug and what type of adrenergic drugs helps in the glaucoma, and which one increases the UV sacral outflow, and which one is helpful in reducing the intraocular pressure. All of these things comes under the medical management, people. Apart from that, you have this, like antibiotics, topical antibiotics, and then anti-inflammatory topical. All of these things could come. And then mydriatics, myotics and mydriatics, you have to remember. And then speaking about the surgical management, you have this cataract surgery, glaucoma surgery, corneal transplantation, vitrectomy, retinal detachment, and refractive surgery. So these are all the surgeries you may expect to see it in the ophthalmology. So surgeries, medical management, cataract, glaucoma, retinitis, conjunctivitis, keratitis, trachoma, anatomy and physiology of eye. Your ophthalmology is done, people. You can confidently say 70% of your ophthalmology is done. Remaining 30% you can adjust it in somewhere. Okay, so technically your target is to reach the 70%. So in order to reach that 70%, you have to master these four areas in particular. So with that, you can able to complete the ophthalmology. And thank you everyone for watching the video. We will see you with the next subject.